afternoon, everyone. Myself, Dr. Kirti, Assistant Professor, Physiotherapy Department. Today, I'm going to tell you about active movements at the upper limb and lower limb. So, usually, flexion extension occurs in the sagittal plane, which divides the body into right and left part. Next, rotation, that is lateral and medial rotation, which occurs in the transverse plane, and it divides the body into upper and lower half. Abduction, adduction, which usually occurs in the frontal plane, which divides the body into anterior and posterior part. So starting with the upper limb. So basically the first joint is the wrist joint. So active movement at the wrist joint, which is usually performed by the patient, not by the therapist. That's why it is known as the active movement. So the active movement at the wrist joint, first like wrist flexion, wrist extension, radial deviation, then ulnar deviation. Now at the radioulnar joint, there is supination and pronation. Now at the elbow joint, there is elbow flexion, then elbow extension. Now at the shoulder joint, there is 3 degrees of movement. So 6 movements are possible at this joint. So first we are having the shoulder flexion. Next we are having the shoulder extension, shoulder abduction. Next shoulder adduction. Then rotations, that is external rotation and then internal rotations. So moving towards the lower limb. Starting with the ankle joint in the lower limb, the first active movement is ankle dorsiflexion, then ankle plantar flexion, eversion, then inversion. Now moving towards the knee joint. First we are having the knee flexion, then knee extension. Now at the hip joint, there is also 3 degrees of freedom. So six movements are possible. So first we are having the hip flexion, next hip extension, hip abduction, then hip adduction. Next we are having the rotations, that is hip external rotation, then internal rotation.